We ready? Cool. All right, thanks, Tali. Welcome, everyone. I'm really excited for our panel today. If you're joining us for the first time, this event is being hosted by the Environmental Justice Leadership Forum. The Environmental Justice Leadership Forum is a national coalition of environmental justice community groups from around the country. We have 44 groups in 23 states. And these are folks who are really doing a lot of local and state work to advance policies to protect their communities. They do everything from working on policy and legislation to research, community organizing, and are really anchors in their communities in a lot of ways. And so a bunch of those folks will be joining us. Today's panel is part of our annual Environmental Justice Leadership Forum Advocacy Day, which is an event that we hold each year to bring those folks from EJ communities around the country into Washington, D.C., and to be able to meet with their representatives on the Hill. So there's a lot happening today. You know, some of the folks in the room and in the Zoom are joining us from APHA. And so there is a rally organized later on the mall. Apparently a lot of the access from or around the mall area is closed, which is why everyone's stuck in the traffic, but they'll be here. And I really appreciate you all taking the time to join us and rolling along with all the things that are happening and with us starting late. So as you all know, community-based participatory research has been around for a long time. And when it started, it was a lot of researchers interested in studying communities and understanding, you know, from their perspective, what is happening. A lot of health scientists, social scientists, and others. But it's incredibly important, in our opinion, for this research to be done not just with community members where they're invited in for parts of the research, but to really be driven by community members. And so I think we've got a really great panel of folks here today to present to you the different ways that they've been working with community and some of the tools that they've been using in order to really engage community members and ensure that the research that they are doing is helping communities to understand the underlying issues and pollution that they're facing, having the right tools to be able to actually achieve the goals that they are trying to achieve, and being really hand in hand in the process of developing that research and making sure the outcomes really speak for their community. And so with that, I'm going to bring up our first speaker. For folks in the Zoom room, the slide deck is going to be shared with you, and Tali is going to be managing that. If you have questions that come up during the presentation, please put them in the chat. I will be monitoring the chat, and we will be able to ask the panelists at the end. Our first panelist, Jordana van der Selt, our Director of Environmental Health here at We Act for Environmental Justice, is going to come up and talk to us about some of our longstanding partnerships in West Harlem and the community-based principles that we've developed around how we work with different universities. So Jordana, come on up.
I will advance my slides.
Yeah, and then for your slides are here. It's swirling at me. This is your slide. This is your slide deck back here.
Ooh. Oh, it's swirling.
Tali, can you pull up the slides? I think we can also follow along because our thing is getting stuck.
Does that work?
Yeah,
Great.
awesome. It's stuck on our end, so we're just going to have the speakers ask you to advance slides.
Yeah.
Sounds good.
In the room, it looks good, right?
We can make it bigger.
Yeah.
I think this is probably the best way.
Yeah, that's fine.
Okay.
Okay. And I know we are tight on time, so Denise or Danielle, like, cut me off when you need to. Okay. Oh. Hold on. Did I do that? Okay. Sorry, I'm stacking computers. Okay. Hi, everyone. My name is Jordana Vanderzelt. I'm the Environmental Health Director at WeAct. And like Denise said, we're just going to jump right into our community-based participatory research introduction. CBPR is the acronym I'll be using today, just for simplicity. But Tali, you can go to the next slide. So I know maybe we have some EJ Forum members, perhaps online in the room, who are very familiar with WeAct. But for those who aren't, WeAct is a Harlem-based CBO. We really advocate for healthy homes and communities in Northern Manhattan, specifically around environmental justice issues. But what I kind of wanted to point out here in WeAct's founding is that we've embedded community-based participatory research into how we envision, the success of our mission. So WeAct envisions a community that has increased environmental health through CBPR, which also advances our evidence-based campaigns. So truly, like, we would probably view community-based research as sort of a movement building tool, as a way to, provide evidence for our campaigns. And, oh, Tali, thank you. I'm clicking the screen. So what I kind of just wanted to start off with, so as Denise said, CBPR is like a rather old concept at this point. There are varying definitions, but I wanted to sort of break down an accepted definition into 4 points here, 4 buckets, just to set up our other speakers too. But CBPR is a collaborative research approach that equitably involves community members, organizational representatives, and academic researchers in all aspects of the research process, start to finish. Establishes structures that enable all partners to contribute their expertise with shared leadership, responsibility, and ownership. Enhances the understanding of a given phenomenon with different perspectives and community knowledge, and integrates the knowledge gained with action and social change to improve the health and well-being. I'll just also note that CBPR is more so an approach to research. So it doesn't dictate the methods you use or the tools you use. It can be quantitative, qualitative. It can be a longitudinal study. It could be a randomized control trial. So it's whatever fits your question and your, design. Next slide, please. And then briefly, I also wanted to touch on, this is not exhaustive at all in terms of the benefits of a CBPR approach, but just touching on some of these main facets. So I'm looking at so many screens. So provides the community an active seat at the table. I think I said this, but this would be throughout the entire research process, throughout every phase, from conception to design to analysis to, dissemination, every point. It enhances the what's next on my screen? Facilitates the building, thank you. Facilitates the building or rebuilding of trust and research among communities. This is obviously important for those communities who have been taken advantage of in historical contexts. Enables the development of culturally responsive research topics that really address the priorities of the community. Enhances the understanding of the research topic. So I would say that, you're not really going to advance science from a top-down academic approach to research, though that's valid in its own way. But truly understanding all aspects of a research topic come from the bottom up. So also increases reliability and validity of research results, since the findings are, again, interpreted within the context of the community. Facilitates community ownership of the research findings, and enables the development of culturally responsive interventions. So the important part here, I mean, of course, culturally responsive, but sustainable, like long-term solutions are able to be accomplished, again, through more of a bottom-up approach. Next slide. So this is a CBR project in recent WEACT history. This project called Out of Gas, In with Justice was implemented in 2021 to 2022. It's a really cool study that I'm not going to have time to tell you the results of necessarily, but I'm going to use this as an example, mainly just to point out some key CBPR approaches that were weaved into this research project. But I can sort of summarize it real quick. Basically, the aim of this study, this study was conducted in our New York City Housing Authority, our New York City Affordable Housing Buildings, which we call NYCHA, which I'll probably use that acronym again. And we wanted to study the feasibility of electrification in these buildings. So it was sort of a controlled trial research design where we looked at 10 apartments with existing gas stoves and then upgraded 10 other apartments with induction stoves to measure the difference in air quality and any other satisfaction type measures that came out of that. But next slide, please. So what I kind of wanted to point out first with this research project is that, again, kind of following along with like WEACT's approach to research, it's research based in action. So it's not research for research sake. It's not that we come up with a hypothesis that we think we want to test for ourselves and we do it. But it's research based on the policy landscape at the time and how we want to support that landscape, those goals, with specific recommendations. So just setting the scene at the time, the CLCPA, the New York's Climate Leadership and Community Protection Act, had passed in 2019. So again, this study was in 2021. So passed in 2019, which did commit to this electrification by 2040. And then along with that, NYCHA, like I said, our Affordable Housing Authority, also had their goal to reduce greenhouse gas emissions. Oh my gosh, I'm so short on time. Okay. Basically, pointing out here that, you know, we come from a policy action background, and then we're trying to like fill in the gaps using our informed community to tell us what is going to work for us to get to these goals. What is actually going to benefit you? What's feasible? Okay, next slide. And honestly, I can kind of skip this, but this is really just to point out we had 3 different sort of methodologies going on, 2 quantitative and 1 qualitative. So of course, we're interested in if air quality is going to improve. But I would say that the qualitative methods truly give such narratives, give such context to the research that quantitative can't necessarily do. So I would always just recommend pairing whatever you're doing with multiple qualitative approaches. Anyways, next. And then just to quickly discuss like some aspects of this research study that were really informed by the community or with the community, you know, feedback in mind. Our partnership development and outreach, we made sure to partner with an organization called Association for Energy Affordability, who already knew this community, who already had trust with the participants, had already worked in that NYCHA building. Were representative of the neighboring communities, obviously spoke English, Spanish. So the trust was there. And obviously that's a huge founding principle of CBPR. And if you're new to that neighborhood, find a partner who's not new. I mean, because it takes years and years and years to build that trust. So that's just something to point out. The other thing I'll point out here, so community discussions and needs assessments. Ideally, if you're doing a community-based study, you want to have those early community discussions and needs assessments collaboratively to figure out like where are the gaps in something that maybe WEACT wasn't thinking of or something that NYCHA is definitely not thinking of. And I'm just pointing out here because something that came up, of course, so our study aim, we're going to give you induction stoves and measure the air quality improvement. Great, thank you. We don't know how to use induction stoves. So that's a very simple initial point of, oh my gosh, let's get you trained on how to use these stoves. Let's get you new cookware, new pots and pans who are going to actually make this transition easier. Next slide, I'm rushing. So then the last thing I'll just point out, there are always, I mean, you go into a research project with your best intentions of what you think is happening in that community. And for this particular study, I'm only highlighting 2 here. There were tons of things that maybe the partners were not thinking of. So we're thinking, yay, we're improving your air quality. That's great. But what the participants brought up was actually our #1 concern is that our apartments are going to light on fire at any moment from the gas. So this was a pilot. If we were to replicate this and you know the word I'm thinking of, size it, that would be built into like the promotional materials. That would be built into the education. Like, hey, did you also know induction stoves are safer in multiple ways? So just pointing out that there's a lot of unintended, insights that you would learn. And again, with a lot of people pointed out that when they had their induction stoves installed, they felt a real lack of respect and lack of dignity there from the contractors who were doing the upgrades and the wiring. So if this weren't a randomized controlled trial, you would probably stop right there, make improvements to your partners who were doing the installation and keep going, as long as it's not like some fidelity issue with the study. But it's always important to build in those feedback loops so that you can, in the moment, improve for the community who ultimately is the driver. And last slide, please. I'll just briefly mention, what does the future of CBPR at WEACT look like? I'll say, I think, so all of our research studies in recent history, of course, utilize CBPR tools and rely on the general approach. What our environmental health team at WEACT is really excited about doing is creating a CBPR protocol. So a public-facing guiding document where we can really say how we want to engage in research with academics and how we want to engage in research with our memberships, with our membership base. Because WEACT is a in a funny position where we are a growing grassroots org who obviously doesn't want to leave our legacy of community work. We want to put onus on ourselves to have that check with how we work with the community, but also we want to come to the table with the process that we want for working with academics. So I think a protocol will really help us accomplish this. I have listed on the screen all of our reasons for wanting this protocol. The historical disinvestment in our area, that only action-based research based in policy can achieve, can change structurally. But I'm definitely out of time. So yeah, you get the gist. Thank you.
Thank you, Jordana. All right. I thought that was a really good overview, and I think some of you probably saw our out of gas report and some of the work we did on that last year. But I think it was a really good example of how we partnered with communities. Next up, I'm going to invite Dr. Chris Heaney to come up from Johns Hopkins Bloomberg School of Public Health. One thing I recently learned about Chris is that he actually started his career working with environmental justice groups in North Carolina. Some of those folks are here today and online. So you'll see, you might recognize some of the names. But I was excited to have Chris join us because I actually heard about his work a few years ago and have been really trying to figure out, like, where is that opportunity going to be where I get to work with Chris on something, because he's such an amazing partner, I think, for environmental justice communities. And so he's going to be talking about some of the principles, theory, and practice that he uses through his work at Hopkins and working with and engaging with community groups. So Chris, come on up.
Great. It's wonderful to be here, and I'm just going to dive right in. I'll set it up by saying we're going to hopefully tee some things up for the next speakers, and I'll just mention that Carlos and I are partners on a lot of work that I think you'll be able to hear him speak about. But framing quickly, going to sort of set up some of the principles and concepts that are like to be aware of, because there's risk in some of the criticisms of deep community participation and research. In some of the context of doing this here today and talking about the principles, I'm going to be encouraging you to do more community-driven, community-led, community-owned and managed. I see Omega and Io Wilson on. But just to be aware, I'm saying this now within the context of states like Louisiana, if anybody's aware, that have passed laws that say community science or community-driven science can no longer be used in statewide regulatory and legal settings. It's invalidating it. And there's been pretty concerted efforts by lobbying advocacy groups on the science technical side of industries to work with legislatures. And Louisiana is one of the first. I think West Virginia is another state that's tried this. North Carolina might also be paying attention to this. So there are implications, and what I'm going to kind of walk through some principles that next slide that aren't really from me. It's from Steve Wing, who taught me at UNC. And I kept wondering, in some of the doc seminar classes, he would always harp on like objectivity and going back to the original philosophy of science and how do you produce knowledge. But so I'm going to kind of impart 5 ideas, key concepts that he talked about for us to keep in mind as we're really striving to be doing co-creation or academics following the lead of community in a community-owned and managed research setting. So, I don't have all the answers. Steve really showed me a lot. And then the next is just another acknowledgments of where a lot of these ideas came from. Next slide, which is that this came out of a workshop that we gave with Carlos, Greg Sautel, for the NIH. So these, I'm just giving attribution here to the ideas are not all mine here. Okay, next slide. Okay, why does this matter? Communities really have answers to causal questions, right? Keep going, next slide. They want to know, is the air safe to breathe in places like this, right? This is going to set up what Carlos is going to talk about with playgrounds right next to a coal terminal. Youth who grew up in communities like this just think that was just a mountain. It happened to be black. They didn't really know what it was. It was a mountain and it's cold. And they also, next slide, are wondering, is the water safe? Or how about here? Is the air safe to breathe here in fence line communities? This is where Steve grew up in New Orleans and outside of New Orleans. Some of the communities at the fence lines of petrochemical industries are wondering, it's a causal question. They want to know how safe or unsafe is the air. And same next slide with the water. When they turn on their tap, is the water safe to drink? So next slide. So there's just, next, click forward. We have obligations. We have roles as academics, right? We get to, why do we go to school? Why do we, in primary schools, why are we trying to continue to specialize? Because our roles create responsibilities and capabilities that can develop responsive answers to these research questions. Put community identified in front of that. That's the whole idea, community owned. But next slide, we're going to go through deconstructing some of what are the biases and threats when it's community rather than another entity who's saying, this is the causal question that I want to have answered. Next slide. And so this is some guiding questions that we all can reflect on, that we struggle with. Fundamentally, what is research? What's participation? What's knowledge? Who creates it? What constitutes scientific evidence and data? What is action? What's actionable? And this is really the 5 things. Is science inherently objective? Okay. And is there an opportunity for there to be bias if somebody's driving the bus towards knowledge generation that's maybe not the entity that would be preferred, depending on your positionality or vantage point? Next slide. So that's going to get to the 5 concepts, and I'm just going to kind of go through them kind of quickly. Next slide. First is we have to acknowledge our positionality and our structural privilege and the history of discrimination of the academe, right? A lot has come out over big major journals, acknowledging histories of contributions to structural racism, histories in the publication record around eugenics. And so this is what the principles of environmental justice were designed to really acknowledge the history and say that the populations, when it comes to disproportionate environmental impacts, they have the right for self-representation with these. And it's not, as we heard the previous speaker, for somebody to come in and just say, I'm here, I'm in a position of academics, and I'm here to kind of save the day, when it comes to these. Next slide. So one article that was really helpful that Steve made us required reading in a lot of the classes was from the Baltimore Sun. And it was just this anecdote about an academic teacher and a student coming in and kind of complaining about some things. And really the question, how could the instructor help the student understand their position of privilege, right? And so that's really critical in a lot of this. So it's the understanding that typically academics would be feeling like there's some accreditation, there's some inherent card that they possess, like a passport or a credentialing that allows them to be able to be the ones who are the purveyors to those initial questions of what is new knowledge and who can create it. Next slide. So here, a lot of great work has been done on this. This is from some of the University of Michigan M-Lead Center, Amy Schultz. I think we've got Juliana here in the audience, which is great to see. But really wonderful work that's more recent that gets this first question of what's your positionality? Next one, more work by Devin Payne Sturgis here that really is trying to make our field pay attention to this. And this is hopefully not new to you all. These are reference points for a lot of people in this first one. Next slide. That gets us into next. Just think about this, okay? If you're going through school and you're going through a graduate program, maybe in a school of public health, maybe in environmental health sciences, and you're interested in an all-in-state academia, has anybody heard this? Get to know your program officer at NIH. Get to know their priorities. Make it not NIH, make it a foundation. Industry, who are seeking permits to release pollution to air, water, and land, also support research. So the advice can be, get to know the officials who can support and fund your research. That's a client, okay? I just want everybody to say. And click forward, please. So how do these clients shape the priorities, right, of research questions? Click forward. And how do these clients perpetuate knowledge gaps in specific topics and in places and in particular neighborhoods, okay? And that really is the fundamental thing about why 100-year, the oldest coal terminal in the country, could have never had anybody who would support and say, we need to answer, is there coal dust across the fence line into the community, into the neighborhood, right? How many NIH program officers are saying that's a priority for trained individuals to go out and get money to do that? So it's clients, community as the client is one way to think about it. Why is it intrinsically more biased if the community is saying, hey, this is the question that we should be answering? Okay, next one. Next slide. Okay, so Steve wrote about he focused this on who's epidemiology, who's health. Keep going forward. Okay, next, the third concept is, so it's not just, so demystify, why should the community saying this is the question needs to be answered? Why should that create less objectivity? Then next we get into transparency about conflicts of interest and alignments, okay? This includes financial and non-financial. Click forward, please. And we really, really have to hold ourselves to a higher standard. Often journals policies might be, well, you're not, if I'm trying to say I'm aligned with a community organization, right? And but I'm not, the community organization isn't paying me directly. So we've had to explain to journal editors often that we would like to explain, even if it's pro bono, that there is an alignment there. Click forward, please, because the industry's track record on some of this. Keep going forward. Few more. We're going to keep going. The industry's track record on this is often they'll do science inside of a company, right? Like Monsanto. They'll figure out the answer, and then they'll try to get an academic to ghostwrite it, right? And they'll try to hide that, or they'll work through academic journals to do that. So we have to hold our, and this is one example. Keep going. There's another slide. Here is the Monsanto example of Roundup. And so it's about this alignment. If we're going to say we're going to do like the Louisiana law, lean into it, we're going to do community-owned and managed research, be transparent about that. One way to do it is to elevate community partners as co-authors. So they're co-creators of the knowledge on manuscripts. It's undeniable. You can start, that opens you up. It's a risk that in states like Louisiana, they could claim, well, that's community science. And so it could be, they could try to argue that it's not responsive or not permitted in terms of providing information that regulatory authorities could use to add conditions to a permit, for example. But at least we're being faithful to the principles that we're not doing what industry does, which is to hide these relationships, okay? Keep going forward. We'll get to hopefully the fourth one. Okay, yeah, and Steve wrote about this by setting up before a study, he'd say, who co-created it, who co-designed it? This is the work that he did around industrial hog production in North Carolina. And it lays out the relationships and who's co-creating and who the client is. Keep going forward. That gets us to where people typically debate is objectivity in science. It's your methods and your study design. Okay, so I'm hoping to arm you with something that says, just because community are the client in the antecedent three, you should be able to hit back and say it's no less biased. It should not be biased. It should be no less objective. Here is where we can really sit and talk and debate with the Louisiana, Department of Environment scientists or the lawyers or the attorneys general. Tell me where our methodology was wrong. Tell me where we didn't do the science up to a rigorous standard to answer the causal question that the community said needed to be prioritized. And so this is all in where we look and what we do and the study design, and we heard a lot of cross-sectional longitudinal and all that. So keep going forward. We'll get to this, and this is kind of a keep going forward. I like this little keep going. Okay, so absence of evidence is not evidence of absence. Okay, industry exploits doubt. Doubt is their product, right? The longer they can have doubt, take the lead in gasoline, take tobacco's playbook, right? How long can you stretch out products and have a profit margin because there's no evidence of harm? And it's outpace the communities to basically say, when are they going to catch up? How long is the latency for cancers that might be attributed to my product that I'm producing in a facility with permits to emit to air, water, and so on? Go forward, but just keep that in mind because we don't want to do the lamppost, right? Like Mr. Burns is basking in the glow of his nuclear power plant that supplies all the light for Smithfield. I'm sorry, for Springfield, Illinois. Freudian slip with for Smithfield, North Carolina. But here, just don't say that because you're not able to look where the industry doesn't want you to look in the communities that you're not finding any harm. So more decades will pass to say there's no problem. Keep going forward. And so that the final one is keep going. Click forward. Keep forward. We'll keep going forward. Is rationalization. Right? This is the idea that we all have to hold ourselves accountable, and it's an ongoing process. It doesn't really ever get easier. Keep going forward. But you have to be a certain level of self-critical and inward and outward. And this is, I don't know, I have to say, in academic career advice, it's not a trait that really helps you get up through the promotion process as quickly. You kind of have to be the opposite of this. You have to say, I did this, I'm leading this, these are my ideas and all that. So keep going forward, but instead of a weakness, keep going one more, it should be a strength. That we should really be able to hold ourselves to do community-owned and managed research, as Omega Wilson put out there into the world. And we should be able to be honest about where anyone could come in and say there might be opportunities for bias or less objectivity, and not shy away from that. But I think some of the other examples that we don't have time to get into today, but maybe we could talk about, is if you really spend the time listening to the acute adverse impact in neighborhoods, then I think with the way that the industry has sort of worked the clock to just hope that nobody came in with the right resources and the right teams to kind of look at things, that often it's such a massive signal to look for that you can do really good causal science. And we've done that in the Orange County Regional Landfill in North Carolina. Steve Wing did that around swine CAFOs. We're seeing some of the same things as we just repeat the same question the community's been asking for 100 years. You see kind of the same answer coming out around coal dust emissions. So I'll pause there. That's kind of the last slide. The setup next is that CBPR, community engaged research, and community engaged research, as a lot of the federal agencies have defined it, and under the previous administration, community engaged research, just to be aware, it's on a continuum, okay? And that there's a big difference between saying, oh, wow, NIH really sees the benefits of CBPR because it can address the generalizability or the lack of representativeness, and if I just learn how to do community engaged research, I can get more people who are non-white into my clinical trials, right? So that's not, but be aware that with what we do, what everybody does, you're going to run across individuals who are going to treat CBPR like, 14 principles, I do number 2 and number 8. Okay, I'm doing CBPR. And then they're still kind of doing academic driven work. Okay, so that's just the other path that I will have a chance to get into. And I will pause it and hand it off there.
Great, thank you, Chris. I think one of the things that I had a real challenge with was, I know that I actually heard a version of this talk from Chris. I think it was like a 20 or 30-minute presentation. I was like, can you condense it to 10? And I'm sure people have questions. So again, if you're in the Zoom room, please put your questions in the chat. We're gonna ask them at the end. And then while you're doing that, if people in the room, feel free to jot down your questions. We're gonna do that as well. Our next speaker, like I said, I was really excited about this lineup, is Darren Riley. Darren is the founder of Just Air, which is a Detroit-based environmental technology organization working to ensure that everyone, no matter their zip code, can breathe clean air and safe air. And so one of our connections to Darren is actually, he grew up in Detroit and actually partnered with one of our EJ Forum members, Green Door Initiative, on a project as well, and has really been centering his work around what community really needs. And so I think for those of us in the EJ movement, I think he's providing an incredible service to be able to help us translate all kinds of data. And he's gonna tell you what that looks like for our needs in ways that communities can really find that useful. So Darren, come on up.
Well, thank you so much. Such a joy and privilege to be here. Thank you, WEAC, for inviting me and get to express some of our work. So how does it work with slides? Oh, okay, cool. All right. Perfect. So yeah, great order too. I don't know how y'all kind of builds upon each other. So I think this is really exciting. What I want to kind of get across and what I want to talk about is more of the kind of feeling, the mood music of this work, and some of the learnings that I've seen. So when we're talking about community-based research, the X and O's and the playbooks on how to do this work the right way and the only way I think there is a underlying tone as well of like how we need to make sure we set standards in our culture and our values as we express this work. So it's less so of what I want to kind of get across is not so much a framework, but how do we weave our culture so this is a long-term practice where it looks weird if or it looks it's not best practice, not because these are the principles to a degree, but because that's just not the right way we do this work. And I'll explain a little bit more of that. Next slide, please. So just a quick background about myself. So actually, Charlotte, North Carolina. I'm born, grew up there until I was like 10 years old, moved to Houston, Texas, and finished the remainder of my schooling there. I say to say is because after college in the Midwest and living in New York for a bit, I moved to Detroit now 10 years ago, which is crazy. And 2 years after I moved to Detroit, I actually developed asthma. I live in Southwest Detroit. I live right next to, right 500 feet away from the highway, the Canada Bridge. So a lot of diesel truck emissions. Never knew what asthma felt like. I thought it was something that you just had as a kid. I had some people who had on the basketball team who had it, but never knew that was something that you could develop as an adult, to my ignorance. It wasn't really, it didn't really hit home until COVID. Seeing personal folks transition, people in the neighborhood transition, and articles come out that said Black communities are hit the hardest, or Black and Brown communities are hit the hardest because of the particulate matter. The assumption that more particulate matter, the more degradation in the lungs, resulted in more mortality rates in COVID. That was a time where I was going through a lot, and I was like, all right, what am I spend my time in as a software engineer? And when I was going to community meetings, meeting folks like Donnell Wilkins, I saw Donnell Wilkins' name on with Amy Schultz, which is super dope. That just making sure those are author, but Donnell Wilkins, Teresa Landrum, a lot of environmental justice leaders speaking to this conversation with government and hearing this kind of tone of government saying, hey, these are issues we recognize. We don't have the data in our reference monitors, these regional monitors, to tell you that your experience is true when folks in the community are expressing their true experience and lived experience is being ignored because there's not data to prove. As a software engineer, I'm like, there's no way. We got facial recognition cameras, we got robots delivering pizza. Like, there's no way we can't build systems to just put digits and sensors and quality assure them to make defense of the data. There's no way. And so that's what we really set out to do. That's kind of the story building up to that. Next picture, next slide. And I can kind of skip this one because we all know why we're here. The health is insane. The one thing I will say about the picture, that's the picture in Dearborn, Slade Elementary, where we do a lot of our work, and just what you saw evidence of factories behind, that's Cleveland Cliffs, steel manufacturer, right behind elementary school where kids are playing, and you literally see kids playing while this stuff is active. And I want you to feel that too, because that's what I'm talking about, the cultural thing. And while I'm here, that's something that, just a quick example, it would be weird if somebody walked into a restaurant and smoked a cigarette, like right next to you. That would be weird. That's the kind of cultural expression in this work and what I'm trying to get across. It should be, I want everyone to feel weird when they walk by and they see an asphalt plant next to a playground, right? That's the kind of, mood music and the tone that we're trying to really set in this work. Next slide. And so on our journey, we started off really small, just connecting sensors to our platform. So we noticed a lot of sensors were not speaking the same language. We have purple layers, we have quants, we have clarity, all the different devices, and government has reference monitors, even though they're not speaking the same language. And so what we set out to do is, one, be on the field, working with GDI. We have Justin right here from GDI doing some field work with us, putting these instruments up, learning how complex the data systems are, learning what quality assurance project plans are and how to do that in real time, learning how to deliver data in real time. And if it's uncertain, how do we check that when we have hundreds of monitors out in communities? How do we make sure that my neighbor Rhonda can walk out the door and depend on that data for her going outside and making decisions of the day? And all that to say, to the point that kind of set up this conversation, is that we want to take all of that work off communities, and that's what you'll see in the pattern, off communities' back and shoulders and that burden, so that they can do the real work of spreading awareness, doing the advocacy, and not being caught up in the weeds of the technology and data management and the things that are not moving the needle, which is storytelling and advocacy, right? Next slide. And so just a little bit quick about our platform. We call it the Universal Air Quality Network. And what we've done so far, and which we'll see in later slides, is really built one platform that unifies all this, from reference monitors to sensors, and do all automated quality assurance. So we have a public dashboard, a dashboard that's for administrators and researchers to build defensible data, so that when we go to the EPA, when we go to our state agencies, we're going and we're talking from a position of strength, that our data is quality assured. So we're not asking questions about the data, but we're asking questions about our experience. We're skipping that whole side, right? So that's really what we're set to do. Next slide, please. And we started in Michigan, and we're really scaling and growing. We'll talk a little bit more of that, but from Laredo, Texas, in the largest inland port, we're doing some really great work there. The tribal land and Eastern Band, Cherokee, and North Carolina, doing great work there. In Louisiana, we just, last week, we just launched Air Quality Network, and the headline says Air Quality Network launched in despite of the law. And we had to do some really unique things that I'll talk about a little bit later in Louisiana to kind of weave around that, right? And that's part of the puzzle. The whole point is that because of the work in communities, and we building upon each other is really what the opportunities community-based research really is, right? Anybody know what ballroom dancing is? Like kind of Detroit ballroom dancing? All right, you know, so I pick up ballroom dancing. The beautiful thing about ballroom dancing is that someone didn't like wake up and say, these are all the moves in ballroom dancing. Is that people start to add on to it as it becomes a shared practice, and that's culture. And that's why we build upon things. Next slide, please. I'll hit these really quick. So some of the, we have about, I believe, 8 or so principles on our website. These are a few that I just want to share examples of. And this is agreed upon internally and also informed by community members as we've evolved our work, and these will constantly evolve. That's another principle in itself. But one is community knowledge, cultural history. I'll speak more about that. Next one is transparency, justice, equity, and inclusion, iteration, process, and growth, and yes before no. This is our amazing team of organizers, computer scientists, environmental scientists, really coming together to solve some of these issues and spread this work. Next slide, please. So starting with community knowledge, culture, and history. What I learned as a software engineer, I'm a huge data nerd, is that that's not the point of this work. The point is to meet people where they are and express his work in a way that resonates with folks, right? So I love what was said earlier about making sure that community is with you from the very onset. I would say step -1 and step 0, when you're creating budgets for grant proposals, who's getting paid, sharing those dollars. That's something that we got to be really clear about in Grand Rapids. Make sure that people who are facilitating, putting monitors up, are budgeted out in a budget before we even come up with an objective, when you bring people to the table. And even account for that time that they're spending to build a proposal. I'm just keeping it real. I don't think that gets said a lot, but that's something that we really want to, anytime we're doing something like that, leading that effort, we want to make sure we pull folks in at step 0. When we do our community monitors, we don't set instruments on the wall. We make sure we're working with the churches, the neighborhood associations, having these workshops at time periods like 5:30, 6 o'clock, when people are off work. Make sure we're providing food. Make sure we provide childcare, so when people are off work, they can bring their kids and also they can eat, right? Making sure that when we're doing work in a zip code or neighborhood, that we give a sticker on folks who are actually from that neighborhood, where we have researchers and maybe government folks, so they get the first word and the last word. These are things that I just like spilled off, but this is a natural way of how it's not written anywhere, but this is naturally what feels right. Again, that feeling, that cultural, and is being very expressive as a shared practice. What you see here on the right is really an expression of that as well. We're part of this project, East Canfield, where we built, well, I didn't build, but they built a amazing crown statue that represents 2 African queens from the East and West. In the middle of it, you can't see, but it's an air quality monitor, and there's a bulb that changes color, representing the crown gem. It changes color based on the air quality index. What you don't see, you see a lot of green. What you don't see is, like, if you just to the camera go like this, and this means like I just pan a little bit to the left, that's Stellantis. And that's paint emissions going to the east side of Detroit, where people are getting sick and having cancers. And really having this art be a disposition. When you drive by it, you drive by this beautiful art and you see Stellantis, it's like, wait, why is this here? Right? To really create the art. So again, how do we weave our data? How do we meet people where they are? How do we be creative? How do we get engaged kids and creatives into this work? Again, really set our culture and our history in stone. Next slide. Transparency. Just a little bit on our platform. And one thing we want to be clear about is openness. When you have folks 3 minutes, perfect. Folks who are depending on data, we got to tell you when the monitor is down, when there's issues with the instrument. We do that in real time through our data practices. When people ask for data, you can go on Just Air, download all the data that's in your network. You don't have to do a FOIA request. All that stuff is being very transparent. When we mess up, we have to tell you we messed up, right? We have to be clear about that. So we want to be very adverse to hiding away from our issues and be clear about transparency. Next slide. This is probably the most important one. Yes before no. I think in our communities, they keep it real. We often hear, no, we can't do that. Oh, this doesn't fit the research mold. That technology doesn't exist. Meanwhile, we got people trying to fly to Mars, and they tend told yes all the time. Can blow up spaceships all they want, trial and error era. And so what we do is, yeah, we can't put up monitors in Louisiana. Nah, yeah, we can. We're gonna figure it out. We have to do different things. We'll go to our council. We're gonna figure it out. This is a pilot where a group was told they couldn't figure out a way to put samples in real time to show that on a public map. We walked with folks through the design process, and we're putting that up as well. Next slide, just because of time, we went fast, but I want to hit that point. Iteration, process, and growth. We built an air quality connected inhaler to track pollution as people are having asthma attacks. Where are those triggers coming from? This is the first in the world. No one's thinking about those problems. Why? Because folks are trying to understand. It's not kid going to school using their inhaler. What's going on in the school? That was up with the kid. And when you're talking about children who are having those asthma attacks, or when I had an asthma attack, you are afraid to go tell somebody. You don't want to be a burden on somebody. And so having tools that can automatically track that traumatizing event is really important. We built a trucking app to track trucks automatically and show air quality data so the city can issue a truck ordinance and understand and advise where trucks should go in the road. All this is informed by community. Raquel Garcia, Southwest Detroit Environmental Division, was sitting on the porch tracking trucks. Why are we doing that? Let's put the monitors up, put the cameras up, and get going. Next slide. Fly by these. At the end of the day, all this work is churning outcomes. In Dearborn, they have electrification of school buses. We're seeing the data in real time. That's hitting education, attendance. That's improving the well-being of the whole neighborhood. It's one of the most polluted zip codes in Michigan. In some of our work, what you see on the left is we had a dust ordinance. In the work that we're doing, there's a dust ordinance in Detroit. They never enforce it. Now the city is actually subscribed to the monitors, receiving alerts, and not waiting on community members to call them and say something's going on. They're going to use our data to go out there and do something about it. Again, their response to that. Next slide. I know I'm way over top, probably. And last but not least is that I believe that if we do this work in the culture and the soul and what's natural and be bold and is living, is breathing, is that we will start to see, and what we're already seeing is that other agencies will start embedding and adopting this culture and make sure it's actualized. So we're here is one of the most advanced air quality agencies, South Coast Air Quality Management District. They're using our platform to enable AB 617, which is a community air quality monitoring work in California. And what's really powerful about this is that instead of government being on one side of the table, community being on the other side, they have oversight and guidance and taking that data management piece off the community. So they're on the same side of the table facing these problems together. And I want to see this replicated. I want to see how we can really empower this and elevate this. And what's really powerful is that all the stuff we built is from communities. So they're using, the top agency is using what communities informed, via the vessel of the work that we're doing. And I think the last slide. And last slide, one of our, I think the sixth principle is gratitude and recognition. Thank you all so much for all the work you're doing. Thank you, all the mothers, I'll just say it out loud, that have been on the front lines and doing this work, protecting our neighborhoods before, I was born, and who knew what we would be if it wasn't for those folks and those mothers who were protecting and being on the front lines. Like, because we're here, may not seem like progress is always happening, but who knows what would happen if we were not there fighting, continue to fight. So just there, next slide, last but not least, we're here to support. We're here to do what we can do. We're gonna say yes before no. My team hates it, but we're gonna make it happen. And last but not least, let's really focus on our culture and make sure that it's woven, it's braided into our work, so it's everlasting. And someone can't weave a policy, but it just feels weird to not do it the way we do it. Thank you.
Great. Thank you, Darren. How are folks doing? Yeah, we had a whole, for people in the Zoom. Some of you, I know, are members of EJLF. We had folks come straight off the hill, grab some lunch, and into this panel. So I'm checking on our room over here. something that I hope our next speaker will experience soon. So our next speaker is Carlos Sanchez. He's a lifelong South Baltimore resident, and is now working with the South Baltimore Community Land Trust, one of our newest members of the Environmental Justice Leadership Forum. And I had the good fortune to actually join them for an environmental justice tour when I was in Baltimore in September. And they've been doing some really interesting things around community monitoring and evidence collection that I thought would be great for you all to hear about. For those of you who don't know, the community in South Baltimore fought off a proposal for the largest medical waste incinerator is planned to be built there. And it was a huge victory. They're continuing to fight on an incinerator fight that I actually have worked with them on, that is still impacting their community. And Chris was talking also about, you know, the coal port that's just outside their community and blowing dust in. And so there's been tremendous amount of work done there. And I'm excited for Carlos to share a little bit about some of their approaches, tactics, and really give that community perspective of if you don't always have the opportunity to do a long-term research project on air monitoring or engage directly with the researcher, what are some other things that you can do? And that's what I asked him to talk about today. So Carlos, come on up.
Denise, I don't think I have these slides.
What'd you say, Tommy?
I don't think I have the slides.
They're in the Google folder. I
Mm,
shared with you. I think that Carlos put his name on them. It's
oh,
like,
they're as a PDF. Sorry, that's why I didn't see them. I don't know the best way to.
Whatever works. If we can scroll down, we can scroll down.
Cool. Okay, does that work?
Yeah, that's fine. Okay, so want to start out by saying thank you all for inviting me and being able to speak here. But one of the things that I wanted to talk and highlight about was having the accessibility to what communities can do to things that are accessible to them, right? And just to talk a little bit more of what Dr. Keeney mentioned, having those academic partners to bring those scientific research, that scientific data to legislative, and being able to keep that within the community, having to show what the community is dealing with. So if we just go on to the next slide, this is just a few examples of what it is in South Baltimore on top of what was already mentioned, which was, shutting down that proposal, the CSX open air coal terminal. And, the little map in the middle, really highlights what is in the community, which is 70 stationary polluting facilities that's currently monitored by the state's agency, which is the Maryland Department of Environment, or MDE. And that doesn't include the 70 doesn't include those that are not currently being monitored. And I'll scratch the surface of that in just a second. But we have the nation's largest medical waste incinerator that recently pled guilty to 40 criminal counts. We have a Quarantine Road landfill. We have a Grace Chemical, which is the biggest, Baltimore's largest source of toxic releases. We have a Petroleum Management Inc., or a corporate company that caused a deadly fire that unfortunately killed a worker. And that is the same facility that has been operating without a major source air permit for 10 years. And that is the same facility that's now seeking to expand less than a mile away from, literally across the street from a local high school that I graduated from. And the last one is that we'll touch base on is Reconserve, which is an animal feed investigated that was investigated by the FDA for serious safety violations. So if we could go on to the next slide, please. And this is just a map to highlight how close these facilities are within South Baltimore and in Curtis Bay alone. And you can see where it says BFHS, that's Benjamin Franklin High School, and that is across the street where they're planning on expanding the PMI. And you can clearly even see how close it was already to the community, to Ben, and how it is in the community, and how they're seeking to expand even closer. So we go on to the next slide, please. And just to give a little bit more context on why it was so important to touch base on a lot of these facilities, one of the examples being the Curtis Bay Energy, or the medical waste incinerator, which takes medical waste from all around the states, all around the country, and even as far as Canada. And this was the same facility that was fined $1.75 million after a 2 to 3 year investigation where they pled guilty to 40 criminal counts for, basically to sum it up, was they weren't processing their medical waste as they should. So they weren't burning it properly, and they were sending it to landfill fully burned. And if you think about medical waste, you think about the very small, the gloves that, the doctors would use, to the more biohazard orange baggies that you would see in doctors' offices. So we go on to the next slide. And what happened was that during this investigation, they pled guilty to those criminal counts. But we realized that when we were giving a tour, we saw that something that really scared the community, which was there was black smoke coming out of the building, right? And just like the example that you see in front of you, and when we spoke to those people, because it's within a bunch of businesses, we went to speak about it and kind of see what was going on. One of the things that really caught our attention was that they were saying that was something that was normal. That's something that happened occasionally. And it wasn't even black smoke that would come out. Sometimes they would come out pink, sometimes it would come out blue. And when we heard about that and not being able to show like what was exactly going on, that really pushed the community to see what was something that we can do to keep facilities like this under observation, and kind of be able to show that to, their clientele, to be able to show that to legislators, and, have that evidence. And so these are just a few examples when we first started monitoring, and there are a few years back, but I like to show it because we were able to, these were just some examples that we were continuing to see, and we were able to use these screenshots or these snapshots that we were able to capture by like a trail camera that, you would usually use during hunting or anything like that. We set it up and we were able to capture these, and we were able to even use them to file a new, excuse me, a new lawsuit with the state of Maryland against the medical waste incinerator. And we're even to this day, we're still collecting more instances. We're still collecting similar events like this. And then every time we were able to see them and clearly show, we're also sending them to the Maryland's office to continue that investigation. So we go on to the next slide. And one of the most recent tools that we've added to our toolkit, which is the introduction of drones. Right, a lot of community concern was, you see a lot from on the ground, right? But there's things that you can't see, right? What's going on beyond where you're restricted to. And so we were able to introduce drones to be able to get some more of that transparency, and be able to bring that data to communities to be able to, again, be able to see what you wouldn't see on the ground. And we go into the next slide. For examples for this is the trash burning incinerator, Bristol, that, a lot of it, support of this facility would say that, it's the waste, right? What we're going to do to address the waste if we get this out of the community. And when the community residents really realize that, a lot of the majority that gets burned isn't trash, right? It can either be composted or recycled. And we were needed to be able to show what was actually being, burned. So if we go into the next slide. So thanks to the introduction of drone cameras, we were able to really be able to see what is actually going to the facility, and you were able to see anything from your cardboard boxes to leaves and even the Christmas tree. And we can go on to the next slide. And so this is just a few examples of the different things. We would see wood pallets, we would see furniture, more trees, and just, all being categorized as trash and all being sent to the same place to be burnt. And yeah, can we go on to the next slide, please? And, this is not the only instances that we've been able to use the drone camera. One of the other facilities that we've been able to show was the reconserved animal feed. And this is a quote from their website, which is, they provide a clean, safe place where they will be able to manufacture the food and feed for animals nationwide. And we go to the next slide, and this is the ironic part, which was that they were actually, they received a warning letter from the Food and Drug Administration back in January 2024, based on inspections on the previous year, where they were, basically, one of the things that were the three major things that were highlighted was that there was food left outdoors, rotting outside in the hot sun. There was birds pooping everywhere, and this is all things that were, of course, the runoff, contamination, and other sources of pollution. And again, this is things that if you think about what you feed your pets, sorry for anybody who has dogs, cats and dogs, stuff like that. So we go into the next slide. That facility actually replied saying that, they resolved all their issues and everything was up to code again, everything was working fine. But something that community know by at this point is that you can't really trust the word of industries, especially those that have been highlighted for doing things wrong. So as community members, we decided to check in and really see what was going on. And we go into the next few slides. Well, so what we were able to see was that same thing that the letter highlighted. You know, there was still food rotting out, there were packages unopened, birds pooping everywhere. And you know, the thing was like, you know, everything was highlighted in the letter we were able to see again, right? And I can't even explain the amount of the smell that came from the building. It was really bad, and I felt bad for the person who actually took us because that smell stayed in their car for a few days. And but we were able to present these pictures and these findings to the Community of Curtis Bay Association to file a new complaint with the FDA and MDA so that they can further investigate. And we can go on to the next slide. And these are just, again, we were able to introduce the drone footage. And after we filed that complaint, we were able to see that they, fixed the trash. And then this is now going into a new facility, which is the PMI. That was, again, that was the one facility that was investigated for a deadly fire and, you know, operating without a permit, especially being a major source. And we were able to see different things again to the drones, where we would see spills, we would see different things that was going on. And again, this is all, and I think this is the last slide. This is all to show the like different things that we were able to do due to using tools that were accessible to the community. It wasn't a lot of, you know, like monitoring, but different things that the community could have access to be able to push these investigations, to be able to push for more research. And you know, it was as simple as getting a drone training, and then training some youth that were after school will be able to come out and fly and, you know, learn a new skill. And as well as, you know, the other thing is using trail cameras. Again, things that you would use for hunting, we were able to repurpose it in a way to have and stand out for communities. And yeah, that's all I have. Thank you.
All right, thank you, Carlos. So we're almost at time. So I appreciate the folks who stayed until 2:30 for our speakers. And again, sometimes we have to adjust when the government's a mess and there's only one door into each of the buildings when you're trying to have Hill meetings with your elected representatives. So I really appreciate everyone's patience, and for folks who are able to join. We have a couple of minutes. We do have a couple of minutes for questions. Before we get to that, I'm going to call Danielle up because we were going to do an interactive activity. So I wanted everyone who's in the room has a worksheet, and I think we're either dropping the link in the chat for the Zoom, or we'll definitely email it out. But it's a really great resource. So I'm just going to have her explain it.
This is a bad idea. Hi everyone, my name is Danielle Mangabat, and I am the Environmental Health Coordinator at WEACT, working on a lot of our community-based research on beauty justice, working on other issues like pesticides and climate emergency preparedness. So we created this worksheet. We were supposed to have an activity that kind of takes you through the process of issue to action, basically identifying the issue and then working with your community to identify what types of tools, resources, and perhaps a few barriers or obstacles you'll meet in terms of, you know, different misalignments or just challenges when you're talking to institutions with more power, obviously, and different funding challenges. So we encourage you to take a look at this worksheet. Hopefully it can help you think of ways to apply CBPR in your community projects. And please let us know if you have any questions about the specific parts, but hopefully you can apply some of the approaches that were mentioned today from our wonderful panelists to get this worksheet filled out for any project. But thank you. If you have any questions, let us know, but feel free to take some more if you know anyone else who wants them.
So for folks who are in the Zoom, I see a little bubble for chats, but is there any questions in the chats for the panelists? No, I don't see any. Does anyone in the room have any questions? We have one in the back. Christy.
Yes, hi, my name is Sarah. I just had a quick question. I believe it's for you. I've run into this issue where I want to incorporate CBPR, or if I'm helping the community for example, with coalition building, as we're fighting it, you know, like data centers, for example. And I've been told that as a researcher, I cannot write about it because of bias. So I was thinking, you could agree or disagree with me, but how would you go about that? Because you gave some good input, but, and they could draw it to methodology, et cetera, but what do you think?
So let me just see if I understand. You're saying that there are claims against you about a bias that you bring to the table as a researcher?
So in Arizona, we're seeing a lot of data centers come because we don't regulate our water. So it's like the wild, wild west, right? And so as myself, being a researcher in natural resources and environment, I also happen to be part of the coalition of our data center. A lot of people are saying, hey, should we document this? How do we elevate this work, right? And so we have different arms, you know, we have targeted tenured professors saying, hey, we need you to put out an op-ed, or hey, we need you, so we're trying to put out tentacles, but in academia, how would you see that relationship, and how can we elevate the community voice without being dubbed as, oh, everything you wrote is biased, because you're part of it?
Yeah, no, I mean, I think that's probably many people have encountered that. How do you maintain a claim of scientific objectivity and rigor if the person who's most, if the party or the entity that's most familiar with the adverse exposure is the agent putting forward the either the solution or the request for change, right? And I think that's across everybody's stuff. That's everybody faces that. So there's a couple strategies we've used, like Carlos, maybe if you want to speak about the editorial op-ed that you co-wrote with an academic. I mean, that's another way, is to team up. Do you want to speak about that a little bit when it came to the Cherish Act?
Yeah, I think to highlight what Chris was saying, you know, it's being able to find that partnership that is somebody within the community that knows about what's going on and knows about your role, and find a way to be able to get together to, you know, address a lot of it. What that op-ed highlighted was, you know, being frontline communities. There was a lot of experience and things experience that community had dealt with. And it was just being able to introduce that academic partners being able to bring that scientific research and bring that scientific validity, if that's the word for it, to back up what community was saying.
And so Carlos co-wrote it with the department chair of the Environmental Health and Engineering Department, who's also the lead of the like M-Leads at Michigan. We talked about earlier, there's a similar NIEHS Center of Excellence in Environmental Health Sciences at Hopkins called CHARM. So Carlos and Marcia Willis-Karp co-wrote an op-ed making the argument, both the scientific argument and the lived experiences argument, for a statewide policy on cumulative impacts, like New Jersey has had success with. So I think co-creation, putting the voices together, the academic and community together. But I mean, I see so many experts around the room who probably have as good of an answer as maybe I do.
Yeah, I just had it's always comes up, right, and people plan to talk about it along the way, but the same academic institutions are also some of the ones that are involved in some of the research that covers our efforts, right? And so, one of the things I've been with CPR for a long time, and so one of the things that we also want to see is that our community members are actually the principal investigators, not the academic, because it continues to have that bias and it continues to push us in the direction of inequity and extractiveness from our communities, right? I really appreciate you mentioning about the AB 617. It wasn't perfect, but I was very involved in the whole creation of the monitoring network at the time, the largest in the country, and then also informed state legislation policy. It didn't get us to reduce all the emissions we wanted, but it got people a seat at the table. And so sometimes we always think about, okay, what is that we still need? So I really appreciate that, but I think that, it continues to be that whether you're at USC or at Michigan or any of these universities, you have a state institution countering our efforts. And so we really need to think about that moving forward, how we recreate the world now, because we're not, after everything that's going on, we got to think about the new future and really think about it, because all these things again, we need the academics, but academia has been a problem in our efforts. There's good academics, and you mentioned Steve Wing. I know he's someone that one of my closest friends. But that was her mentor, so you mentioned Steve, like, oh, I texted her, hey, I mentioned Steve Wing, and she's from North Carolina, Nebraska. She's like an excellent academic, but she also came from the movement, the youth movement, and the environmental justice movement. So she knew that in order for her to do what she needed to do was to be in the space, and she came from the space and went just to do research to support our communities, right? And so we gotta think about who is the next investigators, because at the end of the day, the scientific integrity, whose scientific integrity at this moment, whose, and at whose cost? Our community still. So just something, it's always like just transition and all these pieces, and I know it could be complex, but I just want to highlight that because we have the ones that continue to, yes, we have good academic partners, like I said, but we at the end of the day, it's our data still. We own the data, and it's still our problem, and we are still the ones being overburdened. So that's all. More like a comment, but really appreciate the presentation.
Maybe just mention one other thing, because
Can you say your name so people know?
oh, yeah, this is Jordana Vanderson. But just like one other point to that, because we all come to the table with our own biases, like that's just part of our own organizational missions and whatnot. I mean, I think with that out of gas study, we have like 6 to 7 partners. So it's not always just an academic working with the community, or an academic, a nonprofit, and some community members. It's like a whole swath of partners who obviously bring their own biases, but hopefully if you're collaboratively like working on a methodology that you can really back up, I feel like that is like a fail-safe in a way, but also, getting all those stakeholders, because we had like governmental, private, contractor, housing authority, so that's just to note, yeah.
Yeah, I just wanted to comment. My name is Anthony Wong, and yeah, I think it's really interesting to interrogate who are lobbying these accusations of bias, right? So the oil and gas, you name it, whether it's tobacco, oil and gas, any industry that poisons us, have these scientific studies that they, either submit to FDA for approval for their toxic products, or to EPA or some other organization to get their permits. Those are created by scientists, and I guess they're unbiased, right? I guess they're being honest about their emissions, their toxicity, whatever it is. But why are they not calling themselves biased? That's a biased point of view. So, and so you may have your biases, that might be true, but so do they. So how is it that they don't call themselves out on their own untruths? And then the other thing is, I think that there are basic scientific integrity issues that any researcher, whether they're lay researchers or academic researchers or industrial private actors, there is scientific method. And if you're truthful and if you have integrity in developing and designing your study in a way that is objective as you can make it. And I think the gentleman who spoke said, be transparent about all the things that went into your design and all the things that went into your interests. And lay it out there. This is what I did. These may or may not have been my biases, and this is what I found. And you can judge for yourself. But I think we need to interrogate where these accusations of bias comes from.
I was going to I appreciate your comments. I was going to make one quick comment. It just makes space for research is critical as laid and super important. And having efficacy in the white paper, policy, long-term evidence, right? I think making space for and like lived expression of data and things that are happening at the same time. Right? When someone gets an alert, when someone you heard that actually hit a little button from my head, when someone uses hey, when things are happening in real time, that's like a partial time. And why do I say that? To your point of philosophy and advice, calling a spade, it's a power structure dynamic. We all feel it, we all know what it is. Oxygen, what's the oximeter, the thing that on your finger, the doctors, that was like late 90s, 2000s, 2023, like 2 decades, where they realized that it doesn't work on black skin. People are passing away because they thought if you had black skin, you had it on there, you were breathing okay because the light didn't get through your skin. Like this is an example of, okay, that passed FDA, that passed billions of dollars. So I think to your point, integrating, but also interrogating and doing the research and combating. I also believe space where a lot of people can't wait. Now we can just really be out there, really pushing the narrative where all things real time.
One other thing I wanted to say, this is Chris, is that why do you think there is a law in Louisiana that's attacking the community-driven science approach? Would there need to be a law for what's threatening in some way to structural reform? So I don't think you're wrong. I think like, yeah, it's always gonna come the highest claim. But Omega Wilson, who was on community managed research, like with the right information, with power, you can unseat a lot of the special interests that don't want to be on the back foot. You know, they're not used to that. So I think I just will lean into it and speak the truth and just keep saying it and say, your proof's wrong. Are we really wrong with the facts as they are said around water and data centers or whatever this is? Steve taught me when he pivoted to worker justice issues for the paper that he published that showed cancer effects in nuclear facility workers that the previous studies didn't show because they didn't do the latency long enough. It's like FE 101, they're denying all the workers' cancer claims at the nuclear facilities, the federal facility, because they said there's no evidence of cancer. The night before the journal was going to publish his paper, he got a call from this, you published this paper, you proceed, your career is going to be dead. They were intimidating because they knew how game-changing that evidence would be towards. So I think it's a sign also that you're on the right track. Again, this is not.
So just to pause, I think a lot of we've lost people off the Zoom mostly. I we love you if you're still listening. The rest is just X'd out. But I think we're gonna close the Zoom and there we go. Go ahead. And we do have a break, so you guys can keep chatting. We have a little break and there's snacks. I know people have late lunch before our next session. So we can keep continuing in the room. Join us in DC next time, please. Keep trying to get them to come out. But yeah, we're gonna close the room. So Charlie, if you want to go ahead and do that. Thank you so much, Charlie, for managing the slides.